appreciate everybody being on the call. I know there's been a lot of confusion. Hopefully yesterday's email where Mike Wisco was giving Harris County the green light on our plan is good. The big thing I want to clarify is that Harris County Public Health is wanting us to move forward, not just with the licensed nursing home facilities. We want to move forward in Harris County with all 250 congregate facilities. And then public health will be working as a priority based off of the red flags that you identified during these assessments. And then those 44 outside the city of Houston nursing homes so that we keep the state happy with us. So anyways, again, I appreciate everybody being on here. I'm going to go ahead and mute myself, and I'm going to let Chris with Public Health and his team take lead on going over the assessment. So, Chris, do you have the form pulled up to go through?
Yeah, thank you, Chief Reed. We have a brief presentation, and the form is actually embedded in the presentation. So, as Chief Reed said, I'm Chris Fredriel. I'm with Harris County Public Health. And I just wanted to start out by thanking everyone for helping us with this. This is a really big ask from the White House down through the governor's office, and no one agency could actually accomplish this alone. So it's actually a really great thing that we can team up and knock this out. As I said before, this is a two-pronged approach. So we have assessments and we have testing. Currently, what we are asking is for assistance with the testing or with the assessment portion of it, and we are following in behind in order to conduct the testing. With that, I have Angie Wimberly here, who is one of our epidemiologists, is going to go through the form, kind of the purpose of the assessments, and also the importance of the assessments, as well as, oh, I froze up there a second, I'm sorry, as well as just kind of walking through the actual form. And then following that, we have Dr. Singletary here, who's our safety officer that's going to go over donning and doffing the PPE that's required in order for you guys to conduct the assessments. Again, I'm going to try to share my screen here so that we can get to the presentation and go ahead and get started. Let's see here. Let's see if I can work this technology. Can everyone see that okay?
Yeah, you're good.
Perfect. So I'm going to hand it off to Angie Wimberly right now, as I said, and she's going to go ahead and let us know, let me know when to change slides as per we're all in different locations. So Angie, take it away.
All right. Hi, everyone. My name is Angie Wimberly, and as Chris mentioned, I'm one of the epidemiologists here at Harris County Public Health. And so this is going to be pretty quick. We're just talking about congregate settings and the assessments. So basically what it is, I'm not sure if it's on the next slide. Chris, can you go ahead and change slides? Okay, so this does talk about it. So basically MDT, which is multidisciplinary team, was built to assess congregate facilities, mainly because they pose risk and factors and determinants for infectious diseases due to the extent of the spread through specific modes and exposure. So most of the times right now we're looking at tier 1s, and tier 1s are considered nursing homes. After that, we've been to tier 2s, which are livings. We've done tier 3s, which are acute care hospitals, psychiatric treatment hospitals, all the way to 4, which is like detention centers, homeless shelters, transitional housings, things like that. And so as most of you know, when you are within a congregate setting, it's not as spread out as when you are in individual homes. So because these people are living in such close quarters, of course, the risk for catching COVID-19 goes up. So as it says there, the most notable congregate settings are medical type facilities, healthcare institutions, long-term care, nursing homes, and like I mentioned before, like homeless shelters and transitional housing. Next slide. So the goal for MDT is to identify and manage ill residents. So as epidemiologists, when we get a case in a facility, we have to do our case investigations, which is only on that specific person. And what we've been tasked to do for MDT is to do all residents, all staff, and basically assess the entire facility. So we've broken out into a couple of different branches. Testing is one. The epi side is another, and then MDT, which basically goes in and assesses the facility in its entirety. Some of the things we do is we consult staff on what they need to do as far as proper PPE, donning and doffing, how to take care of residents when they're ill, what kind of signs and symptoms to look for. We help them acquire supplies and resources. For admin and training, we do a lot of sick leave policies, occupational health, surge capacity for staffing, which is basically when they're looking for additional help if their staff is out due to being ill with COVID, equipment and supplies, and then one of the most difficult for them is post-mortem care. So basically what we do is we go on site to one that we have been identified, usually through the number of cases that they have at their facility. Another way we get these is that they reach out to us saying that they are having some issues and they'd like us to come out. But now with this new order, basically we will be visiting in conjunction with HHSC on-site visits to all nursing homes within Harris County outside the city of Houston. And so one of the things that we bring with us is kind of a report that shows what's the most important things to look for. It used to be quite lengthy, but we have combined it into something much smaller and probably easier to read. Chris is going to go ahead and click on it, the jot form, which is what basically it looks like. So this is for nursing home and other long-term care facilities. It would be different for hospitals. It would be different from homeless shelters, but right now we are focused on tier 1s. So the main thing that you're going to do is the date that you go to the site, the facility name, facility type. The facility type is going to be easy right now because it's just nursing homes. It's important for us to have the address. Sometimes we get a little cross-haired with the city of Houston, and we are diligently checking jurisdiction right now because assessment teams, like I said, are only doing Harris County outside the city of Houston. Can you scroll down, Chris? And then one of the things that we're going to do is we need a point of contact name. So that's who is going to be responsible for getting all of the information that we need, who we're going to be faxing things to, who we can email updates, recommendations, things like that. So that's really important information to get. That's usually either the administrator, someone from HR, or the director of the facility. Usually if it's someone that says that they're the DON, which is the director of nursing, we usually contact them for other things like infection control. So this part is really just for the administrator, whoever is over the entire facility. The first questions that you're going to ask them is mainly the number of licensed beds. That varies from facility to facility, but we want to know how many beds do they have just in case one of our other facilities is overrun and don't have space. Then that way we can kind of keep track, and if we have to move patients from one facility to the other, that's only if an extreme emergency, we at least have that information. We need total number of residents and patients, total number of staff, that's going to be full-time, and that is going to be PRN, mainly because PRN, we're trying to assess for them. They're going to work at usually multiple facilities, and for contact tracing, that's really important. If they work at one nursing home and they're COVID positive and they work at another nursing home, sometimes they'll just stop working at the one that knows their status and continue to work at the other. So that's why we want to get PRN and full-time staff. We like to get the number of hospice patients, number of dialysis. Those are the patients that are leaving the facility. That's very important to get. Total wards and total rooms. That's mainly just because if one of our recommendations is to open up a COVID positive ward, we can help assist them on which facility or which ward they should house their COVID positive patients. A lot of these places have specialty units. We would like to know these sections right here. So vent, trach, dementia, memory, subacute rehab, COVID ward, like if they already have these things in place and if they are already licensed to do these things. And if not, if we have something like a vent trach area, we kind of know there, we're going to probably put the COVID unit closer to that area because they're going to have suction. If they have dialysis in-house or if it's out-house, if they're using a van to take them other places, we kind of get that information. Pediatrics really shouldn't be an issue at this point since we're doing nursing homes, but later on we may be asked to assess other areas. Scroll down. This is kind of just the general information. So basically it's super easy. You're just gonna read this out and check if they have it, yes. If they don't know, pending and not applicable. And if it's pending, you are gonna ask them to send you that information. Some of this stuff is what we're gonna need to assess and evaluate them and if they need a second site assessment. So just as an example, a copy of COVID-19 preparedness plan is available at the facility and accessible by staff. So if they have a COVID plan, you ask to look at it. They show it to you, then you ask staff, have you guys seen this document or seen this plan? They say yes, you just check yes, we move on. If they say no, that's something that's gonna be ran back to us and we are gonna help assist them on getting that COVID plan together. So that's pretty self-explanatory for the general section. And as you scroll down, you're gonna see another section that kind of goes a little more in depth with, let's see, keep scrolling. Management of sick residents. So that's kind of an area that we're looking at for epidemiology purposes and infection control. So the facility has a process to identify and manage residents with symptoms of respiratory infection, and it kind of goes through it. We're looking at daily, and usually most of these places that we have been to have an actual log that has all the vitals of all of their residents or their patients. It says their temperature check, their blood pressure, O2 stats, things like that. If they have it, same thing, you're just gonna check yes. If they say no, you're gonna check no. That alerts us to get with them to go ahead and start that process. Let's see, another one, the facility has criteria and a protocol for initiating active surveillance for respiratory infection among residents and healthcare personnel. Same thing, you're gonna ask those questions. If they say no or pending, it's gonna come to us for us to kind of follow up on. There's also spots, if you scroll down, to put in any notes or remarks in there. That is gonna be for if there is anything that you notice that is of concern or that you think is important for us to know that is not in that questionnaire. So please use that. That brings to our attention that maybe we need to add something in there that'll be more beneficial for the next person that goes out. If you scroll down, Chris, a little bit more. This goes into visitation. This is super quick. Everything on here should be that they just have a plan in place and entrances for no visitors. So all these places right now should not be having any visitors in there. The only type is for necessary personnel. So it'll be like EMS, it would be for hospice nurse, something like that. It wouldn't be the patient's family. That is not allowed currently. So when it talks about PPE, that is strictly for if a wound care nurse needed to come in or someone from dialysis needed to come in to help with the resident, that they have the proper PPE there. And then for visitation remarks, mostly you're just taking notice on if they have no visitor signs at the front door and posted, and that you don't notice any outside family or friends coming in at that time. So that also is going to be super easy. Please use the remarks box for anything that you notice that's out of the ordinary or that you think it's important for us to note moving forward. Next is occupational health. Sometimes they will have the DON on site who is going to be able to go over most of this with you. A lot of times too, the director or the HR isn't going to know these information and they'll say, hold on, let me get my DON or let me get someone else that's going to be able to help better answer those. Totally fine. That's what we're looking for. Whoever has the most information to give us on these sections. So I'll just read one of these off. It says the facility has a process to actively screen HCP for fever and symptoms when they report to work. Let's see, the facility has a process to identify and manage HCPs with fever and symptoms of respiratory infection. That could be anywhere from, yes, we're sending out text messages asking them to report via this app before they come into work. You're just going to ask to see it so you can verify. It could be as simple as right before you walk in, you notice that there's a station and they're taking all of their staff's temperature and asking them the questionnaire. You're just going to check yes and move on to the next one. Don't check yes unless you physically see it. If you don't physically see or they give you a copy of what you're asking for, please hit pending. That lets us know to follow up so we can get that information. You can go ahead and scroll down. Education and training, there's usually someone on site that does that as well. That's usually the director of nursing. They usually keep records of all of this. And most of it is just saying who has responsibility for these things. And a lot of times what we used to do is take the names. Now we just want to make sure that that person can be identified by the facility. I'll just read one really quickly. The facility has plans to provide education and training to healthcare personnel, residents, and family members of residents to help them understand the implications of and basic prevention and control measures. If they say no, again, that prompts us to go in and hand out that information. If they say yes, you just want to see a physical copy of that. If they say, oh, I can email it to you, please just hit pending. You can go ahead and scroll down. Surge capacity, we kind of went over that already. We're kind of just seeing if they have a plan that allows them, if they were to go down in staffing due to a number of reasons, whether their staff is COVID positive and they can't come in, or if they decide to leave for any other reason, what are their plans in order to get other members in there quickly and efficiently, and how that works for them, where they get that information from. So they could say, yes, we have a staffing agency that we're working with. Or they can say something like, we have a sister facility that is willing to let us borrow some of their healthcare providers. You guys don't have to really worry about that. We just want to know if that's what they're doing. Some of those are recommended, and some of their processes and procedures are actually not recommended. So we will actually go over that information with them as the department. This wouldn't be for an assessment. Chris, you can go ahead and scroll down. Post-mortem care, this is basically the same thing. Yes, no, pending. This is a difficult one for them, so I'm not expecting them to have most of it. These will probably either be no or pending. That's fine. Just kind of put in the post-mortem care remarks. If they are looking for certain information from us, if they're requesting anything from us, it would be great for you guys to go ahead and put them in the remarks. That way we could just go ahead, go in there and email them that information directly. If they're asking for a plan in place, we can help them with that. So I'm not too sure that any of this section is going to be yes, but if no, just kind of remark on what they're needing. Supplies and PPE, all of this is simple. We're just kind of looking at what they have on stock. If they don't have it on stock, what their plans are. And then some of this is going to be for on-site assessment. So you're going to look and see if the sinks are well stocked with soap, paper towels for hand washing. You can see that you don't have, it's going to be, oh, I think my computer died. You're on that, right?
It sounds like Angie might have disconnected. Let's give her another second to see if we can get her back on. We've been experiencing a little bit of weather around the county, I'm sure as many of you know. Let's give her a second.
While we're in this pause, just so you're tracking, I know some of you that are not on and you're on via your phone, you're not able to put in questions. For those of y'all that are putting in questions into the Zoom, I'm logging those questions, and when we get done, when we get done, I'll make sure that we go through each one of these. One question that came out of ESD 48 though was the question of is this going to be a task force approach or an individual department? Based on the responses from the survey that we sent out, it appears that it is going to be a individual department assessment that we're requesting at this time. However, there are conversations about if we need to go into additional facilities and things like that. If the ask gets bigger, then looking at moving more to a task force coordinated between public health and CETRAC. Chris, did she get back on? Was she?
Yeah, she's in the process now. Apparently, she lost power where she was at, and so her computer is currently rebooting.
Oh, okay. Okay. So one question that came up earlier before we got on the conference call, just so I can cover it while we're waiting. If you are a jurisdiction that is partially in Harris County and in additional counties, who is going to be doing the assessments and the testing? The testing for sure will be done by the other county. Yeah. Harris County will only go into Harris County facilities. That's their health authority. The other counties will have to be worked through that county's health department. So to answer that one, and Chris, just a point of clarification. Are we treating all assisted livings as skilled nursing facilities, or sorry, that's the question.
Yeah, that's the $1 million question, honestly. Currently, the way that we're doing it is the list that the state sent out. So there are a few different lists going around, and so the list that the state most recently sent out that they're expecting results for, we're going to prioritize all of those. Our ultimate goal is to work through all of the facilities within our jurisdiction, and so we'll get there, but we want to prioritize those that were included in the governor's order as a priority.
Okay, so to clarify that versus the list that I've sent out to everybody, we still want to do assessments at all congregate facilities. However, the 44 facilities that, if you look at the county list that have the word priority next to them, those are going to be the priority for y'all to do testing, correct?
Correct.
Okay, so just as a point of clarification, we need to do assessments at all facilities in the county list that are assigned in your jurisdiction. If anybody asks, or especially municipalities that may have gotten the TCFP letter, Harris County Public Health is going to prioritize those that have the word priority next to them, and then any other ones that are going to be a red flag. So,
correct. Any of the red. So we have a list prioritized as well for as far as the testing measures go, and then if anything arises from one of these inspections or anything like that, then the priority may shift based on our need at the time.
Perfect.
Hey, Chris, can you hear me?
Yep, we got you.
Yes, sorry.
All right, good. I'm on Debbie's computer now. I'm sorry about that.
Back to you, all yours.
Was there any questions for me thus far over anything that I've gone over?
So so I've been logging questions. One question that has come up is if some of these questions are multi-part, being to answer, you need to look at multiple things. Is it an all or nothing to answer either in the yes, or if they have some but not other things, it goes in the no?
So if they have something, I would suggest to go ahead and mark yes, but in the notes, if you notice that something is lacking, please add that. So like what I'm looking at now, if it says signs are posted immediately outside of their residence rooms indicating appropriate ICP precautions and required PPE. So if it's half of that, if they have the PPE part, but they don't have the appropriate IPC precautions, you can hit yes, and then in the notes put lacking PPE outside of residence rooms or ICP precautions outside
Okay, perfect.
Is there another
All right.
one?
The rest are going to be, the rest that I have right now are general. Is there any other questions right now from the group in what Allison's covered so far? So just in space bar or press the mute button. Okay, hearing no questions at this time, go ahead and keep moving forward.
Can you go ahead and scroll down? And so as you can see at the bottom too, it says additional remarks. That's also going to be for something, like I said, if anyone is on scene and they notice something that has not been put in this survey, so please go ahead and add that here, something that we need to address, or if there's something immediate that we can move up the chain to HHSC. And it could be that you're noticing a lot of ill residents there, and that you think that we need to get testing in immediately. Please put that in there, let us know. And like Chris was saying, if you guys notice something in that facility, it may jump our testing up from them being on number 16 to them being number 2. So please make sure that if it's not on that list, we still would like for you guys to document it. And then if you could just put your first and last name, email, and then your signature, that's just gonna let us know that if we have any follow-up questions, if we saw something on there that looked a little questionable, as in like you were saying, the 2 words, the 2 questions, let us know, and we can go over that in there. Or if you have any questions, please type that in for us, and then we can get back to you via your email. And then we will provide our email to you guys as well, if you guys have any questions regarding the assessment. So that's kind of it on the yes, no kind of checklist. So now it's more of a checklist / assessment. We're going to do more of the assessment, and then you guys are really helping us out big time by going out there and getting this information for us, so then we can compile resources and information and then reach out to the facilities ourselves. Okay, next slide. So like I said before, you're going to get all of that. You're going to submit it back to us, and we're going to make a determination if a more in-depth assessment should be performed. That is going to be our strike team, where it's going to be 1 epidemiologist, 1 medical personnel, someone from EPH, and we go out there and do an additional assessment to see if they need additional resources or if we need to get another authority involved. And if any additional assessments are necessary, we work with HHSC, and they're going to go out and perform a little more in depth. They can also do things like put an immediate jeopardy on these places. So that's why it's really important on the checklist that you guys are doing to put anything that you guys notice out of the ordinary or that needs to bring to our attention or the attention of HHSC. Because sometimes we go out there and we do an assessment and we realize there's something that is, you know, an immediate attention ordered to someone else and it's not on a checklist. So please make sure that you utilize those remark boxes for us. Is there any questions over anything that I've gone over so far? I also have Scott here too. So if you have any questions for Scott or Debbie, she's also part of MDT. Please let me know. If I can't answer, I'm sure one of them can.
I'll cover a couple questions that have come in via the chat. So the first question is once they submit the document, if there are pending documents that need to be sent and they send it directly, does the facility need to send it to the person who conducted the assessment, or is there a dedicated email that public health wants those follow-on documents to be sent to?
Hey, this is Scott. There's going to be a dedicated email. Chris, did we get the official email set up yet?
It's in process. It should be finished today, hopefully.
Okay, yeah, we were getting a special email that these reports will automatically be sent to once you guys are done with them. And then that would be the same email address that we would have you give out to any of the facilities. And they can upload any documents and send to that email for us to look at.
Perfect. And then the other question, and I'll answer this just because I also have access to the data. So when we hit the submit, is there a way to know where it goes and can we have a copy? Yeah, so just so everyone's tracking, this is going, the data that's going in is going to go into to the JotForm database. What we will do, the fire marshal's office will do is every Friday, if that's okay, what we'll do is we'll run a report for your jurisdiction, and then the people that we've been communicating thus far, we will share that information. We'll share that information back to you so you have that documentation. Question for public health: what is the urgent number to contact if something needs immediate attention?
That would be the Scott. I'm just kidding.
No, she's right. If you're out there and there's definitely something urgent, I would say you could reach out to me or Chris Frederick. Chris, you can nod your head. Yeah. Anyway, yeah, you can. If everybody's got a pen here, I'll give you guys my work cell. And if something comes up, feel free to call or shoot us a text on there. You can also do email. But my work cell is 713-248-7342.
Perfect. I've got that, and I'll make sure that's also included in the follow-up documentation that comes out after this meeting. Chris, did you want to give yours, or?
Did you see me try to run away from that question? Thanks, Scott. No, it's so the number you can contact is 713-882-8063. Not sure if that was clear. I keep forgetting to have a mask on.
Yeah, 713-882-8063. All right,
Correct.
so we got that one. The urgent number, can we add a question or comment box with alert feature in the event we identify an immediate life hazard issue? Public health, are you okay if we just give a check box that says, hey, we, in the process of this, we identified an immediate life safety issue, and they can check that box, and that'd just be an easy trigger point for your staff that's reviewing the data?
Yeah, that'd be great.
Okay, Chris Turntine, I know you're on. Can you please add that on there? Next question is, I'm going to hold that one. Yeah, and then Tristan said we'll send a report to whoever wants one. So the next question is going to be, the next couple questions are going to be more focused around the facility and authority. So I'll prep y'all. So the first question is we know that a letter has come out from HHSC for the nursing facilities, for those registered nursing facilities. So that would be the 44 that are on the list that, if you look at the county list, say priority next to them, or sorry, the 45, because Chief Ramon reminded me I missed one. So there'd be those 45. The question is does that same letter work to go into the other congregate facilities, the assisted living, IDFs, all those other things?
That's something that we'll have to get actual clarification on. My initial reaction to that question is no, because it's specifically talking about the nursing home facilities and not assisted living or long-term care facilities or things like that. But we can get some more specific clarification, and then it's also possible that a couple of days from now that a similar letter may be sent regarding those facilities. But we'll get clarification on it, you guys, because we want to know the same thing.
Okay. So following up on that question is what happens if providers go out to a location and they're denied access, whether it be a registered nursing home or another congregate facility? How would you like them to proceed forward?
I would say on that, we're not here to push the issue. If it's a place that's not being compliant with allowing you entry to the property, you can simply leave some contact information, and if they're even willing to accept it. But then just go ahead and notify us and say, hey, we were at this facility. they weren't letting us in, and then we can get in contact with HHSC to whom they cannot deny access.
Okay. All right. So that answers that one. We'll come back after we talk about PPE. We answered that one. That denied. So the question is, have these facilities, so all congregate facilities, has an email or letter gone out notifying them that first responders throughout Harris County are going to be coming in and conducting an assessment?
That letter should go out today, notifying them that this is all going to start up. I'm sure a lot of them have already kind of got wind of it, but the letter should go out today.
Okay. And then the last question as it relates to facility actions. So in the letter in the notification that came out from the state, some of the facilities were tagged as green, meaning that they had been assessed within the acceptable time period, and they were in green, labeling them as complete. I then transposed that over to the county list as complete. Do you still want them to assess those locations?
So if the assessment, our directives right now are, if the assessment was done after April 15th, then they are in compliance. If it was done before April 15th, then they need to be reassessed again.
Okay, so even if it says complete, please go ahead and conduct an assessment on that facility.
Well, if it says complete, then they are technically in compliance, and so if they tell us that the assessment was done, they should be able to provide that information to show that it was done, and as long as it is within the 30 days, then they are in compliance, and we should not have to assess that facility again.
Okay, perfect. Okay, that has answered less the PPE questions, which we'll cover after we go through this. All the facility questions. I'm going to do a quick pause for anybody who didn't type a question and has a question that has not been answered. Okay, hearing none, I'll hand it back over to Public Health to continue with the briefing.
Okay, so now that we've kind of gone through the survey tool and the purpose of the surveys, I'm going to hand it over to Dr. Larissa Singletary, who's now going to go through the PPE portion of the training. And here she is.
Can they see the video?
Is there a video?
I don't know how we switch.
They can see the video.
They can see.
So you'll just back out whenever you. So you go through your slides. Yeah, Zoom. I know.
Okay, sorry guys. Hi, I'm Dr. Singletary. I'm going to go over the PPE with you. Chris, how do I get the slide to go back?
Push back.
Technical difficulties. Okay, so the PPE that you guys are going to be needing is pretty minimal. It's going to be just a standard surgical mask, one layer of gloves, and then shoe covers. And the shoe covers we're giving you because, you know, a lot of nursing homes have carpet, and so it's a little harder to clean them. So we just want to make sure that your shoes are protected as well. And then I'm going to say this a few more times during the presentation. The golden rule when we're in these facilities is to always stay 6 feet or more from others. And this is not only from the patients, but this is also from each other. So we want to always practice really good social distancing. Okay, so this is really easy. This is a really simple don sequence. You're going to start with your shoe covers. I always recommend that you try to put on your shoe covers. So these are the shoe covers that you're going to be wearing. And I just want to make the disclaimer, I recognize that a lot of you have a clinical background, and so donning and doffing PPE is something you're a pro at, but I'm just going to, just in case there's anyone who has never encountered PPE before, I'm just going to go over it and hope everyone is covered after that. So yeah, well, the first thing you want to do is you always want to start with hand hygiene. We just like to have good habits. Then you're going to put on your shoe covers, which I have here. So I just recommend that you guys put them on as soon as you can once you get into the facility, wherever there's a good place, if there's a lobby nearby. But yeah, you don't need to necessarily put them on right before you go in. It kind of just depends on the layout of the facility. So after that, you're going to put on your surgical mask and then your gloves. So easy peasy. So for the doff sequence, you're going to start again with the hand hygiene. You're going to take off your gloves. You're then going to take off your shoe covers. And when you're taking off the shoe covers, you want to make sure, it's going to be hard for me to demonstrate, so I'm just going to have to describe it. When you're taking off your shoe covers, you want to make sure that you're not grabbing from the bottom of the shoe where it's potentially contaminated. You want to be grabbing from near your ankle and taking it off. You're then going to take off your surgical mask and perform hand hygiene again. I always tell people that if you really want to, you can perform hand hygiene between each step if it makes you feel more comfortable. And then you want to put everything in biohazardous trash if available. Are they going to have biohazard bags with them? Okay, we'll provide biohazard bags with it. So you'll want to put it in there. We just don't want to put PPE in the regular trash and then, make the janitors nervous. Okay, so what I really quickly want to go over is how to properly doff a surgical mask. This is really easy, but I just want you guys to do it the most protected way. So you're going to put on your mask and you have these ear loops. What you don't want to do when you're doffing the surgical mask is you don't want to grab it off of your face from the front. You always just want to take it from behind the ears, and that's just in case there is any contamination on the front. And then for gloves, again, I know most of you know this, but just in case there's one person out there who doesn't. So the best way to doff these gloves is you want to grab one of them by the palm and slide it off. And then you're going to come at the other one to take it off from near the edge where it's least likely to be contaminated. And you're going to want to wrap the second one up, just like that. Okay. And then finally, just remember that golden rule to always stay 6 feet or more from each other. The surgical masks are protective as long as you're social distanced. It's when you get within 6 feet of people that you can become more compromised. So you're at much lower risk if you have your surgical mask on and you're 6 feet away. So that's the best way that you guys can protect yourselves. And that's it for me.
All right. Thank you very much, Dr. Singletary. So that is going to be the end of the presentation that we have. If anyone has any questions, we'll be happy to field those at this time.
So one question on the PPE, Chris, is shoe coverings and bio bags. Or are y'all going to provide all those PPE items that were discussed?
We can definitely look into that. We just have to know which facilities will need those I guess pieces of equipment or supplies.
So let's just do this. If you can get, and I'm going to talk about it here in a second. If you can get shoe coverings, and bio bags, I'll come pick those up from you. So we have, working with OEM Logistics, we've secured masks, mask, gloves, and suits, paper suits if so choose, and then face shields if they so choose. And then on Monday, we were going to try to deliver PPE to all the departments that need it on Saturday, but with the potential for the severe weather, we decided to hold off, and we'll be delivering PPE to the departments on Monday. So if we could look to pick up those shoe coverings and bio bags from y'all on Monday morning, then we'll facilitate the delivery of that based off of a survey that's going to come out after this, which is based on departments telling us what they need for the number of facilities that they have.
Yeah, we can definitely, we really just need that number of divisions that actually need the PPE so that we can get an estimated quantity. I know that we have some in stock currently, but I'm not sure of those levels, so we'll have to just check so that we can coordinate those.
Okay, so 2 questions that have come in for the doctor. Are you recommending eye protection?
Yeah, I'm not sure. You cut out a little bit there. What was it?
Eye protection, is that recommended?
Eye protection?
Yeah.
Oh, okay. No, so we're not recommending eyewear, eye protection right now, because if you're 6 feet away, there shouldn't be any risk or very little risk of contamination. And you guys aren't going to be there while people are testing. So, I mean, the chance of there being like an errant sneeze, which then could contaminate your mucous membranes, is really low. So, I mean, 6 feet or more, 10 feet if you like, that should protect you, but we're not recommending eyewear because of that.
Okay. And then one thing just to say though, and public health, just to make sure y'all are comfortable with this, because each of these departments have their own medical direction and their own infectious disease protocols. It's their departments that y'all are recommending the minimum level of PPE. However, additional PPE based off of direction of their own department still is trumped, correct?
Yeah, you guys can defer. We always let you defer to your own internal protocols. So if what your departments want to do is more than what we're recommending, we're totally fine with that. Just make sure that whatever PPE you're using, that you are properly trained, and if it's something like an N95 respirator, that you've been fit tested for the appropriate size.
Okay. As it relates to PPE, does public health have a recommendation or a resource packet that could be electronically provided to our partners that are going to be going out that address PPE donning and doffing for these facilities they're going into?
Sorry, I should say in front of the video. Yeah, so I think, we can share the presentation. Would that suffice? I also have some there's some CDC PDFs that I can share on donning and doffing. It's more than you guys are going to be using, but I can share those as well. Would that suffice?
I think I'm sorry, Doc, this is more directed at when they're at the facility meeting with the people, if they wanted to provide a resource packet on proper donning and doffing for the facility personnel.
Oh, for the facility. Yes, I can. The CDC has some good illustrations and some good instructionals on PPE donning and doffing. Kind of depends on what the individual facility is using, but I can definitely have Allison or Chris send those out.
Perfect. Yeah, Chris, if you can send that out when you send the slides out over to me, and then I'll make sure it gets out to the entire group for their discretion on distribution. The next one is a non-PPE question. So you may be good, Doc, but I'll find a PPE question just to make you get back in front of the camera. If a facility is listed as complete, do you recommend we still reach out to the facility and confirm it was done after April 15th?
If the facility was assessed after April 15th, then they are clear.
But would you still like them to reach out?
I would still like them to reach out just so that they could provide some evidence, or at least inform us who did the assessment, so that, because inevitably HHSC is going to come back and say, okay, who did this assessment? And so we need to know that information.
Okay. All right. So so based on the need to distribute PPE, if the distribution of PPE is a limiting factor in these agencies assisting with the assessment, are you comfortable if they are PPE need, they start on Tuesday? If they do not have a PPE need, but we're still going to get them PPE, can they start on Monday?
I'm not sure I understand the question.
Because we want to make sure that these agencies are aware of these responders coming to their location and they're not blindsided by this. Are you comfortable with them starting on Monday or Tuesday working through their assessments?
So the letter is going out today, so I would start on Tuesday, just so that if we've missed some of the staff, by the time the letter goes out, they have time to catch it and read it on Monday so that they're not blindsided.
Okay, perfect. And then that'll allow us to deliver PPE on Monday, and then everybody good to start going on Tuesday. So far, that is all the questions that I have. That is, and then the questions that have come in via the text box. We'll pause now for departments to ask any other questions before we move on to one last section. That's awesome, man. Silence is golden. One thing that I do want to bring up real fast is as you're going into these facilities, the decision has been made. Andrew, I'll grab that one. Give me 1 second. There are decisions have been made for regulatory agencies, specifically around fire life safety, are not going into these facilities to prevent contamination and spread. One thing that we do ask for your folks that are going inside of these facilities, if you do identify some fire life safety, primarily things, the real big things we care about is if you see some blocked egresses as they're trying to control social distancing and things like that, or you see like alarm panels that are beeping, things like that. If you wouldn't mind letting the fire marshal's office know if it's in unincorporated Harris County, we are not going to go to the facility. We're going to initiate a letter to try to ask them to do things right, just to protect them and protect our employees. And then if we need to, we will escalate that further. But just something for if your guys and gals are in there, please, if you see that, let the fire marshal's office know. The next thing is the one question that just came in is we have a few rehab facilities listed in our area. Do we just go ahead and perform assessments on all our? Yes. Sorry, Andrew. Yeah, we discussed that earlier. When you pull up the list under county list, we ask that you complete every one of those facilities. Every facility that's in the county list that's assigned to your jurisdiction. Additionally, as you're going through, if you identify there are locations that are assigned to your jurisdiction but are really in a neighboring jurisdiction, we ask that you have a good relationship with that representative. Reach out to them and say, hey, we have this one. Can y'all knock this one out, or do you want us to cover it? Just work that out amongst each other. Rodney, for a tracking point, do we want to run this through the fire marshal's desk at Comm Center to assign incident numbers? No, sir. If you decide to do that within your own department, we will be able to track all of this, and we will be running reports daily that are taking the primary list that was given and then basing off of the submissions that you have, each one of you has submitted. The next question that came in, are group homes also included in this?
Yeah, so they are included, but they are not priority at this point. So as I said earlier, we're planning on moving through all of our congregate settings to do assessments and to do testing, but they're lower priority than the nursing homes at this point.
Perfect. And then Paula had a question. If we have additional questions, what's the best email for us to send those to? As part of the list of information that I'll send out this afternoon will be Scott and Chris's email address inside of there as well. See, I threw Scott under the bus on that one, Chris.
I appreciate it.
You're welcome. Okay, what about any additional questions? Okay, barring no questions, what you will see come out this afternoon from the Fire Marshal's office to the people that have been regularly receiving these is you will get a copy of the slides that Chris is sending along with the PPE stuff from the doc that Chris is going to send over to me. You're going to get a link to this webinar that you can share and watch if you have any questions. You're going to get the contact information for Scott and Chris, both email and phone numbers. And you're going to get a survey that is imperative for you to complete so that we can put together the PPE requirements for our team to deliver on Monday to your departments. So you'll see that. Just in general, if it's in groups, is the majority of people only going to send one person into these facilities? Or public health, do you have a recommendation that only one person go into the facility?
As-
So as far as for the number of individuals going in, it's usually best to do these in pairs. Prior to this, we were doing groups as many as 3 or 4. But you know, 2 eyes are great. 2 pairs of eyes would be better.
Okay, so the recommendation is to use 2. However, if your local protocols dictate only 1, that's fine as well. So if you decide, just let us know, and we'll have in the survey how many people you plan to do the assessments, and then it'll have the number of your PPE requests on there. So other than that, I'm going to pause one last time for any questions. Okay, again, everybody, I really appreciate your time. Thank you from the Fire Marshal's office for what y'all are doing to help, and I'm going to let Chris with Public Health close this meeting out.
Yeah, I just also wanted to reiterate and thank everyone for their time and their assistance with this. We know that this is going to be a big effort, but it's really important to keep all of these folks safe, especially in these congregate settings where they can't necessarily maintain the social distance because some of them can't move. But we really appreciate your work. We're here for any questions that you need, and just let us know, and we'll be in touch.
Outstanding. Thank you, everybody. Have a great day, and we look forward to y'all's help making this happen. Thank you.